Welcome to VetFlex. In this video, we'll walk you through how to use oxygen therapy on your VetFlex ICU oxygen cage. Our smart soda-lime-free system is built to simplify workflows, improve outcomes, and keep your patients safe and comfortable. Let's get started. To begin oxygen therapy with your VetFlex ICU, follow these steps to ensure safe, accurate treatment. Step 1. Power on the ICU and open both doors for about 1 minute. This stabilizes the oxygen level inside the chamber with the ambient air, which is around 21%, and allows the sensors to calibrate. Step 2. Check that the oxygen reading is approximately 21%. If it's off by more than 1%, a minor tare calibration may be required. Please refer to the tare calibration video for guidance. Step 3. Once oxygen is stabilized, close all doors and vents completely. Step 4. Set your target temperature and oxygen levels based on the patient's needs. Step 5. Press the internal circulation button to begin oxygen therapy and confirm when prompted. Step 6. Now open the flow meter. The minimum flow rate is 10 liters per minute, but we recommend 15 liters per minute or more for a good balance of oxygen efficiency and ramp-up speed for normal use. You can and should exceed 15 liters per minute in cases of severe respiratory distress or emergencies. Step 7. When the oxygen and temperature levels have reached your targets, you may place the patient inside. Best practice reminder. Unless it's an emergency, it is best practice to prepare the ICU environment before placing the patient inside. If you're using an oxygen concentrator or a low-flow system with 2 ICU units, first, allow the primary unit to reach its target oxygen level. Then, temporarily close the flow meter on the first unit. Now, open both flow meters simultaneously and set them to the same flow rates to ensure balanced oxygen delivery and prevent an imbalance between the lines. Ending active oxygen therapy. When you're ready to end an active oxygen therapy session and remove the patient, follow these steps carefully to ensure a safe transition. Step 1. The most important step is to first fully turn off the flow meter by rotating it clockwise. Step 2. Tap the external circulation button on the screen to stop active oxygen therapy. Step 3. Open the vents, and if the chamber is empty, open the main doors to begin returning oxygen levels to ambient air. Step 4. Allow the oxygen concentration to gradually fall to 21%, which is the oxygen concentration of the ambient air. This gentle ramp down helps prevent sensor shock and minimizes stress on your patient. Step 5. Once the chamber has reached 21%, open the doors and gently remove the patient. Leave the doors open for 30 seconds for the air to stabilize. You may now safely power off the unit or begin a new therapy session. Pro tip: remember to always make sure the flow meter is fully closed before powering off. Powering off without fully closing the flow meter may cause the electronic stop to disengage and result in wasted oxygen. Pro tip: to avoid stressing the patient with a sudden drop in oxygen, it is best practice to wait until the chamber returns to ambient levels, around 21%, before opening the doors and removing the patient. For more support, visit vetflex.com/support.